Hi, I'm Harvey Tyke. I've got 44S, and this is common foot pathologies. So I'm going to start by picking the foot up and looking at the bottom of it, because most pathologies can be seen from the bottom. So we'll start with seedy toe. This is on the outer border of the hoof capsule, between the, well, so it's in the hoof wall, the horny wall, between the stratum medium and stratum external. So that is a breakdown of the laminae and causes wall separation. This is normally by a lesion in the foot, and then a bacteria has got in there and starts working its way through. That's normally found in the toe area. And next thing to do, similar thing, this is to do with anaerobic bacteria, though that is thrush. So like I said, that's caused by anaerobic bacteria. That breaks down in the clefts of the frog either side here. As you can see, so down here, that gets in there and breaks it down, so that turns it, that just starts working at the frog. Then once it's cleared out, so you want to cut it out, ideally antibacterial spray in there, try and keep the foot as dry as possible. That should get rid of it, and then a new frog will regenerate underneath that. Similar to seedy toe is white line disease, but this can be found all the way around the foot. So that is again an antibacterial, an anaerobic bacterial infection or a fungal infection that has gotten into the foot. It's known as a keratolytic infection, and it breaks down again the hoof wall between the stratum medium and stratum external. There's also canker, which is similar to thrush, but it's a infectious disorder which is just an increased production in the horny laminae that produce the frog. So there's too much being produced, so it sort of covers all over here. It's quite horrible really if it's not cut out properly and treated properly. So hoof cracks, they are along the hoof wall. So this bit here, they're normally a lesion in the hoof wall, and there's two kinds of hoof cracks. We have sand cracks, which start at the cornet band and work their way down. This is normally from a direct trauma. And then you have grass cracks, which start at the bottom and work up. This is normally from like feet being left too long, flares, or something chipping up the foot. They can either be vertical or horizontal. The vertical ones normally start from the bottom and work up in most cases, and the vertical ones are normally from direct trauma to the coronet band, which grow down. We then can move back to the bottom of the foot, and we've got corns. So corns come in three types. Have a dry corn, which is normally just bruising, that's sort of the start of it. Then it will work its way to being a wet corn. And then from there it can be a suppurated corn if it gets infected. So once it's infected from being a wet corn, it becomes suppurated, and that's when the infection is in the foot and normally burst out through the coronet band. The corns are found in the seat corn area, which is just in here. So they're normally caused by a foot being too long and the bars folding over, causing pressure underneath, and that causes bruising, which then leads to a corn over time. The next sort of thing is sheared heels or flat feet. They're very similar. Sheared heels is when the bulbs are displaced, and flat feet is when there's so the horse has naturally got flat feet, so there's not enough foot on the bottom. So to solve this, you sort of shoe with a shoe similar to this with the side clip, so you can set it back, bring that toe back, or an unclipped shoe again to just bring that toe back. You can maybe put pads and dental pressure in there to get that hoof pattern axis ideal again, but again that's sort of more extreme cases if the sort of patterns are dropped. The common sort of foot infections are abscesses. So an abscess will be submural or a solar infection. So the submural ones start here and they work their way out and pop out the top of the coronet band, and the solar ones would be sort of still in the hoof wall, but a vet would dig them out and find them that way. So if they're left too long, they'll pop out the coronet band. That is a submural, or a solar infection is one that's just found and treated on the solar surface of the foot. But these are caused again by a sort of lesion in the hoof wall, maybe by a bit of flint or some gravel getting in there, and that gets infected, and over time that pressure builds up. As the white blood cells are sent to fight it, they die off, and that builds up into pus, and then the vet will either pull out the pus and release the pressure, but as the pressure builds, it will pop up the coronet band. There's another thing called a keratoma, which is a benign tumour, and that is normally found sort of here. I don't know if you can see on the camera, sort of this area here. That's just a build up of like tissue in there. It doesn't really cause the horse any damage, but they can be removed by a vet. And then another common pathology Horses that do a lot of road work and stuff is side bone. This is ossification of the collateral cartilages. That can be bilateral or unilateral. So that's more common in the sort of heavier breeds like driving horses and cobs and stuff like that that do a lot of road work. But it can also be found on obviously just like normal happy hackers if they're using the roads a lot. But yeah, that is just the ossification of the collateral cartilages, and it can be very painful for the horse. To treat that, you'd make a side bone shoe, so that sort of follows the natural wear pattern of the horse. So you look at the shoe wear, follow the natural wear pattern, and that just makes the horse land and load as it wants to naturally to make it easier for the horse, because you obviously can't treat it, but this will just make the horse's life easier and be more pain free. Thank you.